dignitaries, honoured guests, and dear friends. Welcome to the Foundation Day celebrations of the Public Health Foundation of India. Completing 8 years since our inception in 2006, and in keeping with our custom, we gathered each year to collectively train the spotlight on a public health issue of global and national importance. We deeply appreciate your presence here today. I'd like to request our speakers and panelists to kindly come onto the stage. To start off today's proceedings, I'd like to now invite our President, Dr. K. Srinath Reddy, to deliver welcoming remarks.
Dignitaries in the dais, luminaries in the audience, ladies and gentlemen. On behalf of the family of Public Health Foundation of India, it gives me great pride and pleasure to invite you all to this Foundation Day lecture. I am particularly happy that you have made it convenient to come on a rainy evening when we have to compete with an India T20 international match. And I'm sure Professor Subhadra Menon and her band of very dedicated organizing committee members will be particularly pleased with your presence today on our Foundation Day. I have great pleasure in welcoming Professor Michael Greenstone, who will be introduced later before his talk. It's indeed a privilege to have him here, and it was fortuitous that he happened to be visiting New Delhi at this point in time. And when we heard of that, we thought we'll grab the opportunity, because not only is the area of his expertise of great relevance to us, but his stature as a researcher in that field is preeminent. I have also great pleasure in welcoming Professor Ramasani, the Secretary, Department of Science and Technology, who has been not only providing stellar leadership to the whole area of science and technology, but has been a great friend of public health and has embraced it with a great deal of affection, which has not been in the past a very usual occurrence. Recognizing the important link between science, technology and public health. I have also great pleasure in welcoming our two eminent panelists, Dr. Leena Srivastava and Dr. Anumita Roy Chowdhury, who will be bringing the Indian dimension of the problem of air pollution during the panel discussion and providing not only insights about the magnitude of the problem, but about the actions that need to be taken. I have special pleasure in welcoming His Excellency Ambassador Freddie Swain from Denmark, who has been a friend of India and a friend of PHFI from the moment he stepped on the Indian soil. Thank you very much, sir, for your presence. The Public Health Foundation of India was launched in March 2006 by the Prime Minister of India as a public-private initiative bringing together national and international academia, state and central governments, the private sector, as well as the civil society, onto one common unifying platform to debate, discuss and deliberate on major public health challenges of the country and to find solutions which they could be implemented in a concerted fashion. We have come a fairly long way in these 8 years since we were launched. As you may have seen from some of the slides that were going on the screen, documenting our progress, we now have 4 operational institutes in Delhi Gurgaon area, in Gandhinagar, in Hyderabad and Bhubaneswar. We have 2 additional training facilities where state health officers are being trained in public health at Gwalior and Bengaluru. And our 5th institute would be soon activated this year at Shillong. While we have our feet on the ground in 7 locations in India, our span of activities reaches across entire India, and we are quite happy to say that whether through education, training, research, health communication, or introduction of affordable healthcare technologies, we are now in every region of India. We have contributed to not only the education of high-end health professionals, but have tuned our training programs, particularly the diploma programs, to the national needs, especially those of national programs. while we have trained about 800 people in our distance education programs and about 700 people in our diploma programs so far, a very large number of the people who have been trained in the Diploma of Public Health Management, which is linked to the National Rural Health Mission and trains district and block level medical officers in public health management. Indeed, even our other training programs are particularly linked to not only national programs but critical gap areas, be it health economics and health finance, or whether it is health promotion and tobacco control. Our research has really been blossoming in terms of a very large number of research publications which have now been highly acclaimed in prestigious international journals with high impact factor. But we do not search for impact only in the quote statistics of journal recognition, but we would like to see it on the ground. And we are now actively engaged, not only through our research, but through our advocacy and health system support in multiple areas, ranging from development of a framework for universal health coverage for the Planning Commission of India, to the development of a blueprint for training of allied health professionals across the country for the Ministry of Health. We are actively supporting now the states of Karnataka and Kerala in design and piloting of universal health coverage in 2 districts of Karnataka and 3 districts of Kerala. So we are now well on the way to be considered one of the key technical support units for the Government of India as well as various states. We are the technical support unit for HIV/AIDS for the Department of AIDS Control, for the prevention component, and we have also, over the last 2 years, been designated as the technical support unit for the routine immunization component of the Ministry of Health's National Immunization Program. I will not detail many of the other areas of engagement, but suffice it to say, we have been motivated very strongly by 2 mantras in all our activities. First is interdisciplinarity. Ours is perhaps the only institution in the world where, in terms of public health training, whether in terms of faculty composition or student profile, we have not only doctors, dentists, nurses, nutritionists, veterinary scientists, but we have anthropologists, social and behavioral scientists, statisticians, epidemiologists, management experts, communication experts, lawyers and engineers, to count among a few. And it is this intermix of disciplines that really brings in the richness of academic learning into public health, but much more impactfully into the practice of public health. And the second mantra that we have is health system connectivity. We believe that in order to be relevant, public health has to serve the needs of the people through an efficient and equitable health system. And that is our endeavor constantly in whatever we do. But we are frequently asked, what is public health? So it may be useful for us to state our vision of public health. Public health is the learning discipline and the practice discipline wherein the determinants of health, which are multiple, which operate at the population level, are identified and influenced to impact upon the health of individuals and communities through multisectoral actions. And keeping that broad compass in mind, we look at public health law, we look at public health engineering, we look at access to essential drugs, we look at availability and competence of the health workforce. Of course, we look at social determinants of health like water, sanitation, nutrition, and environment. And it is in that context that we are looking at today's talk, where air pollution becomes a very important determinant of health. Not merely as a facet of environmental degradation, but even more poignantly as one that imperils human health. And that is why we are proud to have today Professor Michael Greenstone delivering a lecture on environmental health, particularly focusing on air pollution. Previous Foundation Day lectures also have addressed a wide variety of topics through eminent speakers: climate change, primary health care, human resources in health, health professional training, gender and health, and other lectures that were arranged by us on global health, social determinants of health, and so on. We have also recognized that we need to provide solutions, and among the very important accomplishments of the last year, in fact, just a month has gone by, when our engineers have produced an Android tablet with 37 point-of-care diagnostic tests, which can be performed by an ASHA or an Anganwadi worker at the front lines. And this is coupled with decision support systems enabling the frontline health worker to make decisions on the spot for immediate care or referral. And data are straight away uploaded into the cloud to be monitored by anybody who is competent to do so. So this Swasthya Slate has now been launched officially as a part of the Norway-India Partnership Initiative program for reproductive, adolescent and child health in the state of Jammu and Kashmir, with 4,000 units being now put in place to be used by ASHAs and Anganwadi workers. The Swasthya Slate has also been now adopted by other countries like Peru, Timor-Leste, some of the areas in Canada, and now other countries are also looking to it. So we believe not only in describing the problem and finding solutions, and today's talk also will reflect upon the solutions, both in the talk as well as in the panel discussion. I need not really elaborate very much on why we need to talk about air pollution in terms of its magnitude. The World Health Organization just a couple of days ago has come forth by saying that 7 million people died last year because of air pollution. And in India, in South Asia overall, and in India in particular, both outdoor and indoor air pollution are among the leading causes of death and morbidity. And therefore we do need to tackle it. But tackling it requires political will. So let me start with a quote without ascribing the authorship. Smog is affecting large parts of dash country. And environmental pollution has become a major problem, which is nature's red light warning against the model of inefficient and blind development. We will declare war against pollution and fight it with the same determination we battle poverty. To fill in the blanks, the country is China. The speaker was the Prime Minister of China, who was addressing the State Council of China, which is the supreme policy-making body, just 4 weeks ago. So that is the determination that has been expressed. We will fight poverty with the same determination as we'll fight air pollution with the same determination as with one we battle poverty. And if India can summon its resources from across the government, from across the civil society, from across the industry, from across the academia, and provide the same level of resolve to fight air pollution, I'm sure we'll make a good beginning. And our Foundation Day lecture, which brings together all of these sectors, is essentially meant to catalyze this process. Thank you.
Thank you, Dr. Reddy. It is my pleasure now to introduce our guests for the evening seated at the dais. Our guest of honor is Dr. T Ramasani, Secretary to the Government of India in the Department of Science and Technology. He has made critical contributions in the basic and applied sciences and has a distinguished tenure of service, helping to bring Indian science, technology and innovation to unprecedented levels of productivity, prominence and promise. Dr. Ramasamy has worked for over a decade at the Central Leather Research Institute, CLRI. Under Dr. Ramasamy's directorship, CLRI gained global repute, contributing a 35% share of publications and 7% of patents. CLRI's model of do ecology has helped to avert industrial catastrophe and saved 250,000 jobs in the Indian leather industry. Dr. Ramasamy has served as a secretary to the Government of India since the year PHFI was founded. He has pioneered the Inspire National Program, among the largest in the world, designed to attract and retain science talent in India. Under his leadership, the department has focused on the rejuvenation of research in universities, stepping up international cooperation, and linking technology solutions to key societal problems. Dr. Ramasamy is the recipient of numerous awards and accolades, so far won major award every decade in the past 3. He won the Shanti Swarup Bhatnagar Prize for Chemical Sciences in 1993, the Padma Shri in 2001, and has just been announced a Padma Bhushan awardee earlier this year. Congratulations, sir. We're honored to have you. Our guest speaker this evening is Dr. Michael Greenstone. Dr. Greenstone is 3M Professor of Environmental Economics in the Department of Economics at the Massachusetts Institute of Technology, MIT, in the US. He is a non-resident senior fellow at the Brookings Institution, where he directed the Hamilton Project between 2010 and 2013. Dr. Greenstone is also a research associate at the National Bureau of Economic Research and serves on the MIT Energy Initiative's Eponymous Council. In 2004, Professor Greenstone received the 12th Annual Kenneth J. Arrow Award for Best Paper in the field of health economics. He also serves on the editorial boards of prestigious journals and the Environmental Protection Agency, or EPA's Science Advisory Board. In 2009, Dr. Greenstone was Chief Economist of President Obama's Council of Economic Advisors. Dr. Greenstone's research seeks to understand the complex relationship between human welfare and the environment. He has worked extensively on the 1970 Clean Air Act in the US and examined its impacts on air quality, manufacturing activity, housing prices, and infant mortality. In India specifically, Dr. Greenstone has worked on the economic and health impacts of indoor air pollution, the efficacy of environmental regulations, and the costs and benefits of an emissions trading market. Throughout, his work has sought to bring sound economic analysis to bear on the design of public policies that govern the environment. We're proud to have you here, sir. Welcome. I'd also like to introduce our esteemed panelists. Dr. Leena Srivastava is one of our panelists this evening. She is Honorary Executive Director of the Energy and Resources Institute, or TERI, and the Vice Chancellor of TERI University. Dr. Srivastava has an illustrious variety of service to the environment and energy sectors. She has served on numerous boards and coalitions in India and for the United Nations. She is a Knight of the Order of Academic Palms of France, a recipient of a fellowship of Robert Bosch Stiftung just 2 years ago, and has been individually recognized by the Prime Minister for her contributions to the IPCC. She's also joined by Ms. Anumita Roy Chaudhary, the Executive Director for Research and Advocacy at the Center for Science and Environment. Ms. Roy Chaudhary has a distinguished career in research, communication and advocacy on environmental issues with a focus on clean air and sustainable mobility. Apart from her work serving on various national and international advisory boards, Ms. Roy Chaudhary has co-authored the book Slow Murder, The Deadly Story of Vehicular Pollution in India in 1996, and the 2006 sequel, The Leapfrog Factor, Clearing the Air in Asian Cities. It is now my pleasure to invite Professor Greenstone to deliver the PHFI Foundation Day Lecture, entitled Shorter Lives Due to Air Pollution and Some Potential Solutions for India. Dr. Greenstone, the stage is yours.
I'm honored to be invited to deliver this lecture. PHFI is an incredible organization. What you guys have accomplished in less than a decade is a model for energy and activity that we should all can learn a lot from. So I am especially happy to be here to talk about air pollution. I think we're potentially at the dawn of an era of doing something about air pollution in Asia. As Dr. Reddy noted, China is making important strides, and it feels like it's going higher on the priority list in India. And so I thought I would talk a little bit about air pollution today and some of the reasons that I think it's such an important topic for public policy and for public health. So this is a picture, it was in the New York Times in 2012 of Delhi. So it captures a lot of reasons that we might care about air pollution. It's, first of all, unpleasant to look at. There's countless studies demonstrating higher rates of sickness, higher rates of mortality, workers are less productive, lots of resources are devoted to people protecting themselves against that air pollution. And at the same time, that air pollution is a consequence of energy production in many instances. And that energy production is what fuels economic growth. And economic growth is also equally important for public health. And so it's critical for societies to try and find a way to balance those two. So what I'm going to try and talk about today are going to make really just 3 points. The first is I'll try and present some evidence on just the measurement of the extent of exposure to ambient air pollution in India. The second, I'll talk a little bit about some recent research of mine that tries to measure the impacts of exposure to particulates air pollution on life expectancy. And then the third, I'll talk about some speculative or tentative ideas on policies that I think are available and could be implemented in the Indian context. So first, as an introduction, let's talk about 3 facts demonstrating the urgency of air pollution in India. So what we have here is just a graph of average concentrations of PM10. PM10 is a form of airborne particulate matter that people focus on as having the worst health consequences. You can see here the average concentration in India using 2010 data is about 110 micrograms per cubic meter. The Indian National Ambient Air Quality Standard is 60. The World Health Organization suggests maybe 20 micrograms per cubic meter. So there's very high levels of air pollution in India, and in some cities in particular, there's especially concerning levels. The second kind of fact demonstrating the urgency of air pollution in India is without substantial regulation, I think air pollution concentrations are going to grow sharply. The first reason that that's true is India's energy sources tend to be energy sources that are associated with the production of particulates, or the release of particulates air pollution. And you can see here that only 5% of energy consumption comes from nuclear or other renewables. Coal accounts for 41%. It's the largest producer of particulates. The second, as everyone knows here, Indian energy consumption is projected to grow very sharply in the coming years. This is taken from the Energy Information Administration in the United States. Projects about a doubling in the next 20 years. And a doubling in energy production without a more serious effort to reduce concentrations of particulates will necessarily lead to higher rates of higher concentrations of air pollution. And then, this talk was accidentally well timed. The WHO released a report this week suggesting that about 7 million deaths a year are linked to air pollution. Nearly 1 in 8 deaths in 2012. That was widely reported in The Guardian, the New York Times, and all major media. So these are some of the reasons we're here today. And I wanted to now just talk a little bit about how one might develop a measure of exposure to particulate pollution for all of India. So there's essentially 2 ways that this can be done. The first is using the monitoring data that the Central Pollution Control Board undertakes. And those monitors are largely in urban areas. And they are largely focused on PM10. Again, those are the particles that have aerodynamic diameter less than or equal to 10 micrometers. And the reason that they are such a threat is that they are small enough that they're able to enter the body, and the larger particles get caught in one's lungs, and then people cough them out. But these smaller particles are more effective at getting into the body. The Central Pollution Control Board has about 434 monitoring stations spread around about 180 cities, and I'll just try and tell you a little bit about what those data say. So here's a time series of pollution concentrations in India from 1987 to 2010. You can see that the average concentration has been relatively constant over this more than 2-decade period. And I circled cities there that have especially high concentrations. And they're the cities that people are well aware of. Delhi is certainly one of them. Here's a map of the air pollution monitoring stations and their readings for PM10 from 2010 from the Central Pollution Control Board. And anything above, so this is for PM10, anything above 60 micrograms per cubic meter exceed the India's national ambient air quality standards. And so in the green, I guess we'd call that, and the blue are the ones that are below, and the other parts of the country are above. One can see that obviously pollution, the PM10 monitoring follows the industrialization and heavy population centers. Here's a different way to display that same data. This just provides measures of the fraction of the population in urban areas, that's the pink, and in rural areas, it's the blue, that live in places with concentrations in these ranges of 30 micrograms per cubic meter. And you can see that most of the population of India lives, this is in the monitored Central Pollution Control Board data, lives in places where the concentrations exceed India's national ambient air quality standards. So about 380 million out of the 480 million people who live in monitored places have the pollution exceeds the standard. Here's a way to display the same information in table form. And you can see that most of the monitoring about half of the monitoring occurs in urban areas, but the exposure to PM10 is a major problem in rural areas as well. Okay, so now a limitation of that is that the monitors are not everywhere. And so one solution to that, kind of an ingenious solution, is to use remote sensing technology or satellite-based estimates. And what those allow one to do is to be able to develop measures of pollution that apply throughout the entire country. And so borrowing from some important work by Day and several collaborators, we'll try and find a way to display here what the whole country looks like. And so this satellite-based approach compensates for the lack of monitoring throughout the network, throughout India, and it's done in a very clever way where one uses the on-the-ground monitors to calibrate the satellite measures. And this gives, and so here I've switched from PM10 to PM2.5. The Indian standard for PM2.5 is 40 micrograms per cubic meter. And so again, the blue and the green are places that are below the standard, and the other three colors represent locations that are above the standard. And what is noteworthy here is that there's large swatches of rural areas where there's high exposure to PM2.5. And again, this is a different way to say it, to show the same data. So out of about the 1.2 billion people who live in India, roughly 620 million of them live in places that exceed the national ambient air quality standards. Now, it's worth noting that the World Health Organization recommends levels of below 10. So if we were to use that metric, virtually the entire country lives in places that are above the recommended levels. And here's a way to report the same information in table form. And you can see that the average person living in an urban area is exposed at the bottom of the table to about 46 micrograms per cubic meter. The average person in a rural area is exposed to about 51 micrograms per cubic meter. So all that is, can kind of make one's head spin on micrograms per cubic meter and PM2.5 and PM10. Penalties are enforced through criminal law, and those cases take a very long time to resolve. They work themselves through the courts very slowly. So my second suggestion would be to amend the laws to allow for civil penalties, and in particular to have fines for exceeding the standard. That would provide a great deal more flexibility for regulators, and I think allow for a more effective regulatory system. So the third policy recommendation here, which I think kind of falls under common sense one, is that it's not of equal cost for all plants to comply with the regulations. For some, it's more expensive, and for others, it's less expensive. But the current form of regulation has a kind of a one-size-fits-all. All plants are subject to the same regulations, and effectively, no matter how costly it is, all have to achieve the same standard. One solution to that, which has been experimented with and proven to be effective in the United States and in Europe and other settings, is an emissions trading system where plants, there's a fixed number of tons of emissions that are allowed in a given area, and then plants can trade the right to those emissions. And I think as I said at the outset, economic growth is a very critical determinant of public health, and so minimizing the cost of regulation, which emissions trading systems or cap and trade markets do, I think is a very sensible way to proceed. The fourth and final substantive policy recommendation would be, I think, to remove the subsidies for diesel. They lead to excessive consumption of a very highly polluting form of gasoline or of moving in the transport sector, and the redistributive properties that could be accomplished through other means. All right, and the last point that I want to make about policy is that there's a lot of policies that seem sensible and feel like policies that should work, and I tried to touch upon some of them. But, you know, the real world is a lot more complicated than standing in front of a podium and saying people should do this or people should do that. And I think the only tried and true approach to ultimately achieving reductions in air pollution in an efficient way is through experimentation, and really invoking a culture of experimentation and continuous improvement. And so all of these are certainly policies that seem sensible on the blackboard, but what they really need to be done, and what really needs to be done, is they need to be tried in the real world. And alongside those trials, there should be rigorous evaluation to determine which ones are working, and adjustment of the policies as one goes along. Okay, so let me try and conclude. You know, what's the bottom line here? The bottom line is more than 600 million people in India live in places with PM2.5 concentrations that exceed India's national ambient air quality standards. Surprisingly, a lot of those people are in rural areas, at least that was surprising to me, but nevertheless, it's more than 600 million people. What would bringing those areas into compliance with Indian law do? There's 2.1 billion life years laying on the table to be had. And it's an enormous improvement in social welfare that's at stake, and really an incredible opportunity. And the third point is there's a lot of sensible policy responses to this threat of air pollution, but they're all, as I said a moment ago, are going to require rigorous testing to determine what works. So with that, I want to conclude and say I really believe, you know, as someone who visits India a couple times a year, it feels like there's the dawn of an era here of taking the challenges of air pollution seriously and doing something about it. And I wanted to thank PHFI for allowing me to talk a little bit about that. Thank you.
Thank you, Dr. Greenstone, for helping us visualize the problem.